to California Vaccines for Adults program, Year 3 program requirements. This is our third and final webinar for 2018, and we plan to discuss some of the accomplishments of this past year, review some of the patient eligibility requirements, and then we'll go right into program requirements for next year. And we hope to leave plenty of time for question and answers. My name again is Nisha Gandhi, and I'm here with several folks from the immunization branch, all who are involved with different aspects of the Vaccines for Adults program. All right, let's get started. All right, so we thought it made sense as we're moving into the end of 2018 and into 2019 to step back and just review the program goals and objectives for the Vaccines for Adults program. As many of you know, have been involved in the program for approximately 2 years now, a little over 2 years. We just wanted to remind you that the Vaccines for Adults program does provide vaccines at no cost to eligible adults in federally qualified health centers and rural health centers. The vaccines are 317 federally funded, and we'll go into that element a little later. And that this program really is meant to supplement the adult immunization activities happening in your facilities already. And we are really looking to integrate the standards of adult immunization practice into your routine clinical care. The standards can be broken into 4 steps. The first is that assess immunization status of all adult patients at every visit, strongly recommend vaccines that adult patients need, then administer needed vaccines or refer to a provider, and finally, document vaccines received by your adult patients. So let's look at year 2 and see what we've accomplished this past year. When we started the program in 2017, we enrolled 457 clinical sites. Nearly all were FQHCs and FQHC lookalikes. We did have 17 rural health centers. In year 2, we enrolled additional 61 clinical sites, and those sites belong to the FQHC parent organizations already participating in VFA. So at this time, moving into year 3, we have a total of 492 FQHC sites. At this point, we're not looking at new enrollments for year 3. These sites are located across the state. 35% of the sites are in Central Valley, followed by LA with 23%, and then Southern California and Bay Area both have 20% of the sites each. Northern California has about 6% of the sites. We also, in this slide, include the actual number of sites, so you can get a sense of the 492 sites, how they're distributed across the state. So here at the program, we do like to take a careful look at doses administered and kind of keeping track by quarter how all of you are administering doses, and it's been interesting to sort of see the steady increase and sort of the rise and fall from quarter to quarter. And so just taking a look, you can see from 2017 to 2018 how it seems to go up and then it goes down, and it goes up and then down. And so with July to September of 2018, this most recent report that was submitted to us, we got 20,149 doses reported administered by VFA sites. But when you take a closer look at what happened at this point in year 2 compared to year 1, so looking at January through October of 2017 compared to January through October of 2018, you can see there's been a remarkable increase in number of doses administered, which is wonderful news on our end, is to see the number of doses go up for VFA sites. So for that time period in 2017, 57,150 doses were reported administered compared to 80,915 doses administered in 2018 so far. When you submit your next quarter order in January of 2019, at that point you will submit us data for the end of this calendar year of 2018, and then we'll have a good look at what the calendar year of 2018 looked like in terms of doses administered. The other thing that we wanted to take a look at is sort of which vaccines are ordered the most and administered the most, and I think this is probably something that is not a surprise to many of you. Tdap vaccine continues to be our #1 vaccine administered, followed behind by hepatitis B, and then the 2 pneumococcal vaccines, PCV13 and PSV 23. The others were pretty similar, but and I imagine zoster will continue to increase into year 3. So just year 2, as it comes to an end, we've provided program support and technical assistance to 457 clinical sites. We've developed the 3 webinars that are attended by most of the VFA participants. We have systems to collect both the quarterly reports of vaccine data as well as conducting our mid-year program survey, which will help inform our planning for year 3. Thank you again for completing all of those surveys. So I just want to take this time to just step back and say thank you to all of you and all of you've done in year 2 as you've provided protection to uninsured and underinsured adults in California. We see the numbers rising, and so we know that this program is continuing to be implemented with the rest of your adult immunization program. So we're very excited and happy to see the progress. So with that, I'm going to turn it over to Anya Goodman, who's going to review patient eligibility.
Hi, good afternoon, everyone. I'm going to take some time to review patient eligibility for the VFA program or VFA vaccines. And this is in response to the mid-year progress report data where several of you requested some more support around understanding patient eligibility. So I'm going to review some different insurance status scenarios, including Medicare, so that you can become more familiar and refresh your memory of patient eligibility for VFA. But before I do so, we're going to do a couple polls, a couple scenarios, and this is just to test your own knowledge with the program and get an idea of where you might need to review. So first we'll start with a scenario about Sam. So Sam is a patient who, an example patient who is 20 years of age and has private insurance that covers all ACIP recommended vaccines. However, he has a high deductible which has not been met. And we're going to launch a poll, and you can respond yes if you think he is eligible for the VFA program, or no if you don't think he is eligible for the VFA program. Go ahead and we're going to go ahead and launch this poll now. We'll give you about 30 seconds to enter in your responses.
After the 2 scenarios, we will talk more about eligibility and then show the results or the answers to these questions in a few minutes.
Okay, thank you for your responses. We'll go over, as Nisha said, we'll go over the answers after we go over this section of patient eligibility. So the next scenario is, the next scenario is Anna. So we have a patient, Anna, who is 71 years old. She has Medicare Part B, but she doesn't have Medicare Part D. Her doctor recommends that she get Shingrix vaccine. And in this poll, do you think she is eligible for Shingrix through the VFA program? Yes or a no? So we're going to go ahead and launch that poll, and we'll have about 30 seconds to answer the question.
Anya will get to this later, but we do have a host of materials up on EZIZ that covers all of the screening eligibility that we're talking about now. So easy to use charts if you need them in the front, or just information that is very helpful for patient eligibility.
Okay, we're going to go ahead and close the poll. Thanks for your responses. Just a second while we get the tallies. All right, thanks so much. Okay, so just an overview of patient eligibility. We have, so those that are eligible for the VFA program are 19 years of age and older, and they're either uninsured, so they don't have any health insurance coverage, whether it be public or private insurance coverage for vaccines, or they're underinsured. So they have health coverage, health insurance, but it does not include vaccines in the coverage, or it only covers select vaccines. The next slide. So now we'll go over patients eligible for certain VFA vaccines, kind of some particular nuances in eligibility that are important to be aware of, and we'll go into each of these cases in more detail. So patients who receive primary care through county safety net programs, such as County Medical Service Programs, CMSP, or MyHealthLA, for example, those are county safety net programs, and they're not considered health insurance. So they would be eligible for VFA vaccines. We'll also go over Medicare, those who have Medicare Part B, but they don't have Medicare Part D. So those are certain, they may be, they'll be eligible for certain vaccines. And then finally, we'll go over another case where non-pregnant adults on restricted Medi-Cal, or AKA emergency Medi-Cal, will be eligible for certain VFA vaccines. Okay, so again, those who receive primary care through county safety net programs are eligible for VFA vaccines because these programs are not considered health insurance, so they're considered uninsured. And if you have any questions about your county safety net programs, we've put together a list of these programs and the contact information, so you can see the link there in the slide. And then also another scenario is patients who have Medicare Part B but don't have Part D. These patients are considered underinsured and are eligible for zoster, Tdap, tetanus, in the case that the patient does not have a wound, hepatitis B if the patient is not high or intermediate risk. And so you might wonder, why are there special situations for tetanus and hepatitis B? So Medicare Part B, I know it's confusing, or it can be confusing. Medicare Part B covers medical services, including vaccination, directly related to the treatment of an injury or direct exposure to a disease or condition. So in this case, Medicare Part B covers tetanus as preventative care if the patient has a wound. And then Medicare Part B would cover hepatitis B vaccine if the patient is considered high or intermediate risk for contracting hepatitis B. So that's why patients with just Medicare Part B are only eligible for tetanus and Hep B through the VFA program if they do not have a wound and are not high or intermediate risk. So if you have questions about this, a quick guide to consult is the VFA program eligibility based on insurance status and regarding these cases. And it includes a list of conditions that are considered high or intermediate risk for contracting hepatitis B. And then finally, as mentioned, an exception to VFA eligibility based on Medi-Cal status is those non-pregnant patients with restricted scope Medi-Cal, otherwise known as emergency Medi-Cal. So that type of Medi-Cal status does not cover vaccines unless it's needed for an emergency, again, such as tetanus for wound management. So therefore, these patients would be considered eligible for routine or non-emergency VFA vaccines. So most adults, however, enrolled in Medi-Cal are not eligible for VFA vaccines, and that includes adults with full-scope Medi-Cal coverage, pregnant women with presumptive eligibility, also known as pregnancy-only Medi-Cal, and adults with share of cost Medi-Cal. And actually, if you have questions consult VFA FAQs question 8 for more information, and I provided a link, or you can, of course, contact us. So now to review patients not eligible for VFA. As we just mentioned, full scope Medi-Cal, fee-for-service, or managed care patients, share of cost Medi-Cal patients, those with pregnancy-only Medi-Cal, Medicare Part B and Part D, since that covers all ACIP vaccines, and also those that are not eligible for VFA include patients with private insurance coverage for vaccines, even if the patient has a high deductible or copay, a deductible that has not been met, or insurance with cost sharing and must pay out of pocket. So if you have eligibility questions, of course you can always email us. There's also, we've put together a number of different resources that you can review as needed, and these links are provided here. In signing Year 3's VFA provider agreement, it specifies that clinics agree to ensure that all staff, including front office staff, are knowledgeable of VFA eligibility, and that you'll consult the VFA vaccine eligibility based on insurance table as needed to determine specific vaccine eligibility. So take time to review these resources and, of course, email us if you have any questions. So now going back to the answers for the scenarios. Yes or no, Sam is 20 years of age and has private insurance that covers all ACIP recommended vaccines. However, he has a high deductible which has not been met. Is he eligible for the VFA program? And the answer is no. Sam is not eligible for the VFA program because he has a high deductible which has not been met, and patients with high deductibles as well as high copays, cost sharing, or a deductible that has not been met are not eligible for VFA vaccines. In scenario 2, Anna, the 71-year-old woman with Medicare Part B but not Part D, whose doctor recommended Shingrix vaccine, we asked, is she eligible for Shingrix through the VFA program? And the answer is yes, she is eligible for Shingrix through the VFA program because Medicare Part B does not cover it. All right, now I'm going to turn it over to Nisha.
Thank you, Anya, for that review of patient eligibility. So now let's talk about program requirements for Year 3. So I think Anya alluded to the program requirements being posted soon, and just as we did last year, for 2019, there will be a renewal of participation in VFA at the same time as VFC recertification. The form will be, the provider agreement form will be made available at the same time VFC recertification happens. So the process will be the same as it was last year. As part of this process, the clinics will agree to participate according to the set program requirements, and we will, in the next few slides, talk about some of the updates and changes from last year. And then, again, I think Anya mentioned this as well, we want to ensure that all of your clinic staff is familiar with these requirements, which we know is a key to a successful VFA program. Okay. So before we step into the actual requirements, just a few reminders about the VFA program. It is purchased with what's called federal Section 317 funds. So there are no state funds involved with the VFA program. It is all federal funds. We do require accurate accountability, prevention of unnecessary waste, and use only in eligible populations. Participation requirements for VFA are intended to assist in assuring the integrity of the program, avoiding unintended abuse or fraud of federally purchased vaccine supplies, and we will go more into that in a minute. So, Program 3 requirements. One new update, VFA vaccines must be documented electronically. That can occur via your electronic health record or using CARE or your local immunization registry. Also, VFA-eligible patients does not charge an admin fee for vaccines. This is not a new program update, but we have seen instances where program admin fees are continuing to be charged to patients, and so we want to, again, reiterate this particular rule. Third, a VFA poster must be posted and visible to patients regarding the free vaccines available for VFA-eligible patients. And then finally, we've provided some clarification on the provider agreement, which includes the definition for fraud and abuse. So let's start with program requirements for documenting vaccine administration. You may document VFA doses using one of the following options. You either enter the doses directly into your electronic health record, or the doses can go into your immunization registry. IFCARE. We've included information here about your local care representative if you're not already submitting doses to the registry. We also want to take careful note that in 2020, so a year from now, all VFA providers will be required to submit vaccine doses to the registry. We will provide support in the upcoming year as we move towards this requirement, but the intent is that all VFA sites will have doses submitted to the registry. So we will talk more about this in 2019. Fortunately, many of you are already submitting doses to the registry, so I think for many of you this requirement has already been met, but we're working towards getting as many of our doses documented in a local immunization registry. Administration fees. A year ago, we told all of you that administration fees for VFA vaccines must be waived for patients. We have since then discovered that while we shared this information with all of you, that many of the billing departments within your organizations were not aware of the change. And so we are now trying to figure out ways to make sure that this information about the new waived admin fee is being shared with your billing department and with anyone in management so that the changes can be made on the back end of your EHR and your billing system so that these admin fees are being waived for patients. We have made a poster available to VFA sites which is intended to provide information directly to patients about VFA vaccines. The poster shown in this slide is available on EasyIV, and it is a poster that is in English and Spanish and allows clinics to display information about VFA.
And also you can, it provides some check boxes to check the vaccines that your clinics are offering. And we will be, based on the mid-year progress report results, many of you requested print copies of the poster. We'll be working on printing those and mailing them out to you, a copy of English and Spanish each. In the next couple months, we'll be mailing those. So stay tuned.
Thank you. So now I'm going to turn it over to Claudia Aguiluz, who's going to talk about fraud and abuse.
Thank you, Nisha. So in alignment with federal requirements for Section 317 vaccines, we are adding the following wording to our VFA participation agreement. This is, it may look very similar because we have similar language in the VFC participation agreement. And as a state and as we operate both programs in VFA, we are required to ensure that federally purchased vaccines are not only just managed and stored appropriately, but they are accounted appropriately, they are administered, and they are going to the correct populations as outlined by Anya. Thank you for your good exercises that you just shared. So today, with your clinic participation in this session, as well as your clinic's general adherence with all of the program requirements that will be outlined in your VFC recertification, you are already really well positioned to avoid participating in the VFA program in a manner that may lead to unintentional fraud or abuse. And I highlight the word unintentional because oftentimes that's usually what happens. It may be an inadvertent implementation of a requirement or lack of familiarity what eligibility criteria may be, or maybe your systems may not be set appropriately and they may be unintentionally billing for the cost of free vaccines, no-cost vaccines that they're being provided to your clinic, or billing different fees or billing a fee for your patients. So let's go over these two categories. I like to phrase them the following. Fraud, think of it as financial gain, and then abuse, think of it as a financial loss. So the requirement in the agreement will read, all VFA organizations will operate in a manner intended to avoid a fraud or abuse. Fraud is intentional deception or misrepresentation. Really leads to unauthorized benefit to a person related to a service. In this case, a good example would be providing VFA vaccines to non-eligible populations, billing for the vaccines. Like I said, most of the time this is unintentional, or billing for administration fees. Let's go to the other side of the spectrum, which is abuse. That's really referring to inconsistent business, financial practices, or medical practices that may result in an unnecessary cost to the program. An example of this, we usually like to refer to poor vaccine management practices. Maybe not recording temperatures at all may lead to losing your vaccines because you have no temperature data. Expiration of vaccines is considered negligent, which actually leads to unnecessary costs to the program. Or maybe just receiving shipments and not making your front desk staff aware that vaccines are arriving, and oftentimes they may be confused with your normal Office Depot supply order, and vaccines may be left outside. So many of these things, like I said, training, familiar with our agreements, and we hope that this year we actually mirror what we're doing with the VFC program, which is giving you program requirements at a glance in one document, along with links, so that you can help us operate the VFA program here in our state and within your practice in a manner to avoid any financial gain or financial loss of VFA supply vaccines. And, of course, VFC supply vaccines, might as well. So let me turn it over to you, Nisha.
Thank you, Claudia. Okay, so that is the requirements. Let's talk a little bit about VFA ordering. This past year, we've been on a quarterly ordering schedule, and that seemed to work fairly well. The plan right now is to continue with quarterly ordering in 2019. The dates posted here in this slide are tentative, as sometimes things come up or things we can't get systems ready in time, but this is approximately when we plan to open vaccine ordering. So the next ordering period will begin in January. We're looking at January 7th right now. But again, we will continue to communicate with you and let you know once the ordering opens and send you reminders as the ordering period closes. So as a reminder, I'll turn it back over to Anya for resources.
I just wanted to sneak some slides in here just to remind you guys of the provider and staff resources as well as patient resources that are available. Just a reminder, you can get to the VFA resources page at bit.do/VFA resources to find the adult immunization and VFA program-specific resources such as forms, job aids, past webinars, and communications. And then also with the mid-year progress reports, several of you requested provider and staff immunization training resources. EZIZ website, it has a page dedicated to different webinars on immunizations that have been archived that were hosted through other organizations. And there is a page, or there is a tab that includes webinars on adult vaccination as well as vaccine-specific webinars. So please take a look at that. And then also CDC has a number of different immunization education and training opportunities of no cost. There's You Called the Shots, a series of modules to provide vaccine recommendations, links to resource materials, and self-tests to assess learning, as well as current issues and Immunization Net Conference, a link to those net conferences. And see the immunization education and training link for additional CDC immunization courses and webinars. And then a couple other resources were the Medscape. I know we had reviewed it in a previous webinar, but this is always a good one. It has case presentations and videos that offer examples of providers giving a strong recommendation for vaccination with different patient scenarios. And then CDC has a good handout on how to make a strong recommendation for adult vaccination, and it highlights the SHARE method, which is an acronym used to remember different aspects of making a strong recommendation. So we encourage you to share this handout with staff and providers. And then the next slide, just also a quick review of patient education resources that we've gone over before. EasyIZ, there's a link to adult immunization education resources by clicking on the adults or pregnant women tabs, and then some direct links to some of our CDPH materials.
Thank you. And so our final slide is just next steps and important dates to keep track of. Right now, the anticipated recertification launch for VFC and VFA is December 2018, so keep an eye on your email in the month of December. Again, the next ordering period will be we are hoping for January 7th as the launch date. The slides from this presentation and the recording will be posted on the VFA webpage by mid-November. What we'll do is the recording will include these slides as you're seeing them, but we'll also include the PowerPoint slide set so that all the links that are included in this presentation will be live. So you'll be able to go ahead and click on the links and go to all the different resources that Anya mentioned. We are looking at one final evaluation for year 2 for 2018 in December. We're working on pulling together that evaluation now, but it will likely be very similar to what we did in July, and we're also hoping to keep it as brief as possible for all of you. But your information that we're getting from these evaluations are extremely helpful, and they provide us with the feedback that we need to improve the program for you. So thank you for doing these surveys, and look forward to the next survey coming out in a few weeks. And that is it for slides. We have about 20 minutes that we put aside for questions. So I know we both have questions that have come in via the chat box, and continue to do that if you want. We can also line up questions via the operator. So operator, if you want to go ahead and start queuing up questions.
Absolutely. And again, as a reminder, if you would like to ask a question, it is *1 and record your name when prompted. Again, that's *1 if you would like to ask a question from the phone.
Okay, and while we're waiting for that, I'm going to turn over to Christina here, who's going to read out some of the questions that have come in as this webinar, as we've been going through all of our slides.
Yes. So one of the questions that came in through the chat line is, will the VFA program provide HEPLISAV-B, the 2-dose vaccine series?
That is an excellent question, and the answer is yes. We do plan on offering HEPLISAV-B in 2019. It's still unclear what the supply will look like. As you know, when Shingrix came out in July, we were severely limited in supply and really had to cap ordering for VFA sites. Where it's unclear to us right now what the supply will look like initially. Our hope is that there will be some of that vaccine available in January when the period opens up. Our plan also is to do a launch with it, so we will send you a program update and all the information that you'll need to introduce HEPLISAV-B into your clinic. Next question.
The next question that came in, is there an income ceiling for those uninsured? We have patients who make too much income for Medi-Cal.
I'm sorry, repeat the first part.
Is there an income ceiling for those who are uninsured?
So there is no income ceiling for uninsured. If a patient comes in and says they're uninsured, then that is what we take. There is no, you don't need evidence of income. I know that sometimes that comes up in other settings for FQHCs, but that's not necessary for the VFA program because you're going upon the patient's word that they are uninsured. I think Claudia wants to add something.
Yeah, and I think the key is just focus on the eligibility requirements. As you see, income is not a requirement. The requirement is based on insurance. So easy way to find out is if a patient has any type of coverage that covers vaccines. Rule of thumb is no. If that patient is uninsured, then they are eligible. But certainly that's not a requirement.
Okay. Another question that came in, how is one able to denote the VFA vaccines in care that the patient had received VFA vaccines? We have no way to denote VFA in our electronic health record. Any suggestions?
That is an excellent question. There is a category in care that allows for state-supplied vaccines, and state-supplied vaccine would include VFA. So that is a designation within care. We do understand that for EHRs, any sort of modifications will take time, and we're not necessarily asking for those modifications in time for 2020. We understand that that's just going to take more time to integrate. At this point for 2020, we are just requiring all VFA sites to be submitting doses to the registry, however they're designated. But if you do put them directly into care, there is a category for these doses.
Okay. More questions have come in through the chat line. How can we order the posters?
Oh, another excellent question. I'm going to let Anya answer this one.
So we will be sending each VFA site a copy of one English version of the poster and one Spanish version. So I'll send an email to give you all a heads up once we've mailed it out, so you can keep an eye out for it in the mail. And another question is, if a pregnant woman comes into the clinic with Medi-Cal pregnancy only, will the patient need to pay out of pocket?
So they're coming in with emergency Medi-Cal and they are looking to receive TDAP?
They should, under presumptive eligibility or pregnancy Medi-Cal, they should have coverage for TDAP and flu vaccination, other recommended vaccinations. So they should not need to pay out of pocket.
And they're not VFA.
And they are not eligible. They are not VFA eligible. Okay, some more questions. This one's related to ordering. In their situation, they have only 5 doses of Shingrix left, and a patient needs to come back for their second dose. Would they be able to submit a supplemental order before January?
That's a good question. For questions relating to supply and ordering, if you want to just email it to the My317 vaccine. At this point, we generally are not ordering in between quarters, and we are, 6 weeks before 2019? So at this point, we won't, but if you want to submit the exact scenario to us, we can certainly communicate with you directly about your specific order. And operator, do we have anyone lined up?
Yes, we do. We have a question from Jacqueline DiCasa. Your line is open, ma'am.
Yes, my question is that who does the recertification in our clinic?
I think that's a question that might be better answered, by your clinic staff generally. For VFC recertification and also for VFA recertification, you have 2 folks that may actually do this. Part 1 really refers to providing updated information, providing population estimates, because you're doing it at the same time as the VFC program recertification. You will need to update and provide that information, the number of VFC eligibles and VFA eligibles that you are going to immunize over the coming year in 2019. You update just general information about your equipment, storage equipment, so on and so forth. The clinician, provider, the clinic medical director or provider of record for both programs actually need to sign and acknowledge that participation agreement. So in your clinic, then you would have whoever is kind of leading that effort, sharing that communication. But for sure, you will have your medical director who will actually acknowledge and sign the agreement.
Okay.
For both.
Thank you.
Thank you.
You're welcome.
Thank you. And I'm showing no other questions from the phone line, but again, as a reminder, it is *1 and record your name.
Okay. And Christina, do we have any more?
We do. We have some more questions in the chat line. What is a good way to check for Medicare eligibility?
So I believe we have a flow chart or something similar posted on EZIZ that kind of talks about what you're doing with when you're asking patients about Medicare eligibility.
So on slide 18, it talks about Medicare Part B and Part D. There's the VFA program eligibility based on insurance status. You can consult that guide to be aware of Medicare eligibility or VFA eligibility based on Medicare status.
And I do think most folks come in with a Medicare card. I think the question is how far or how much additional questioning do you do to figure out who has Part B as in boy versus D as in dog. And we don't ask that you go through intensive screening or intensive questioning of a patient to see if they have both. We do know that for Medicare Part B as in boy, nearly everyone over the age of 65 has Part B. Part D, on the other hand, is not quite as comprehensive, although many adults over the age of 65 have it. But the hope is that the information that Anya just provided will give you some information, but that we don't ask you to do intensive screening of your patients to figure out if they have Part D versus Part B.
Okay. The next question has come in. Do we still need to fill out the 317 eligibility screening record for adult patients?
Hold on one second.
Well, I think this is an interesting question depending on how you're documenting that eligibility.
Yes. So we talked about electronic documentation now as being the sole. We want all doses documented electronically, either in your EHR or in the registry. The administration form that we're talking about is still available if you need to use it, but that it should also be doses should also be documented electronically.
And I think one of the questions that has come in is how should EHRs users designate the administration of 317 doses or VFA doses in their system? And I think this is where it gets tricky. Similarly, for VFC, designation of eligibility needs to be captured, whether it's in your form, because we're requiring you to start documenting this electronically. I think really looking at working with your EHR vendors to be able to capture not just a dose administered, but by eligibility is going to be key.
And
be able
will
to do
take
that.
time.
Yeah,
will take
certainly.
time.
One last question. Where can we order more 317 and VFC stickers?
That is an excellent question. I will have to get back to you on that. So as many of you know, the VFC store is now closed, and so ordering from the VFC store is not an option. I suspect there are probably hundreds of these rolls in places across the state, and we'll just have to figure out who has the rolls and whether or not we can get them to local health departments to see if the possibility of having health departments help share or distribute these rolls of stickers as requested. But we'll get back to you on the sticker rolls. I know they're very popular.
And then another question just came in. Do we have to document why the person is VFA eligible?
That would be uninsured versus underinsured? That would be the nuance between the two? I don't think so. I don't believe you need to document the
So you would follow the same categories that we have outlined in that eligibility form, which is whether you are VFA or VFA or not VFA eligible. And I think that's one of the challenges, once again, working with the EHR vendors to be able to capture that the right categories would be critical. Same thing for us on the registry. So I think, as Nisha mentioned, over the coming year, we're going to be working with you and providing different tips and different job aids on how to capture and how to document this information appropriately, so that we can easily account for those vaccines. We have been relying on the logs, your usage logs, and eligibility documentation, but I think if it must be captured to the right category.
Okay. I don't think, is there any other questions? No other questions. Operator, do we have any more online?
I'm showing still no questions from the phone line.
Okay. Well, we are done 9 minutes early, but I think, is there one more question that just came in?
Yes. For patients that have Medicare Part A and B, should we refer them to the outside pharmacy?
Well, if they have Part A and B, but not Part D, that makes them eligible for some of the vaccines that, on the slide, that Anya mentioned. I'm not sure why you would refer them to the outside pharmacy if you are not stocking these vaccines. So I would think you would not need to refer them to a pharmacy, that you'd be able to provide VFA doses to these patients, assuming you are ordering and stocking these vaccines.
And I'd like to just go back to the previous question and clarify. I have the eligibility status verification form on my screen, and you do document screening date and which eligibility the patient falls under, and whether they're eligible or not eligible, and which eligibility they fall under. That's part of the screening form.
Thank you for that clarification. And that screening form is on the EZIZ page.
Yes, under resources and forms.
Yeah. Okay, so I think the follow-up question is, if they have Part D, should we refer them outside? Well, I guess that just assumes that my assumption is you're asking that because you are not carrying Shingrix for your Medicare patients, Part D patients, and if that is the case, then yes, referral to a pharmacy is always an option for you. Nearly all pharmacies cover Medicare Part B and Part D vaccines. Okay, so another question, we have both VFA and state vaccines. Is there a difference? Okay, so that's a great question.
That's a tricky question for you, Nisha.
It is. It is. So when we talked about CARE and we talked about the category of state supplied, in that particular category, both federally funded vaccines and state purchased vaccines fall into the same category. But when you are talking outside of the scenario, we have VFA vaccines that are federally funded and state purchased vaccines. Generally speaking, the only state-purchased vaccines that you have access to are flu vaccines. And that is not a VFA vaccine, and it does not fall under, it's not restricted in the way VFA is. So they are different. There are different programs, and they have different eligibility and requirements around them. And you'll see with VFA, flu vaccine has never been offered and likely never will be offered. The state program is very limited in scope and limited in the vaccines that are being offered. Okay. Okay, operator, one last check to see if you have any questions.
We still have no questions.
Okay. Okay, one last question. Do we need to fill out the eligibility form more than once for the same patient? And the answer is no. The form does not need to be completed more than once.
Well, okay, so you only have one form per patient in that medical chart, and each time that patient comes for vaccines, you're just updating the same form. The form actually has multiple spaces for you to enter screening date.
But you are checking eligibility at every visit.
At every visit. You are checking eligibility at every visit, and you only complete one form, and you put that in the chart.
Okay. All right. Well, I think at this point we will go ahead and end the call. Thank you all for joining us today. Our hope is to get these slides and the recording up on our website by next week. We will send out a note letting you know once they're available. And if you've got any additional questions, feel free to reach out to my 317 vaccines, and we'll do our best to get answers to you. So thank you, and we will talk to you again soon.
Thank you for your participation in today's